Hi, everyone. Here we are in the fall. What an exciting time of the year for football, for tons of school activities, for the children, grandchildren, etc. And we're having relatively peaceful weather. This was my week to travel across the country. There's no snow on the mountains in the west yet, which is kind of unusual for middle of September. There's a lot of medical news that is really the headlines right now. Here's my general message to you. Don't lose faith in your doctor, your nurse, your other medical providers, and the system that has served us well. Don't lose faith in our vaccination programs, which have saved thousands, maybe more, into the millions of lives. I was at the end of the generation where polio was a problem. I was at the end of the generation where measles, mumps, rubella were a routine part of being a child. And I lost friends because of that. And I had those diseases. We have fabulous vaccination programs. They have not, by any medical studies that have been done, ever been associated with complications like autism and other things. We've had the dramatic reduction in diseases. Very important to us in public safety, hepatitis B, which used to wipe out a lot of my compatriot public safety workers, whether in EMS, in fire, in police, and in the emergency department, that were wiped out by hepatitis B. We now have a vaccine that's almost 100% effective. Don't lose faith in the vaccination programs. Get your children and grandchildren vaccinated. It's really important. For our people now looking at the diseases coming in the winter, RSV and flu and COVID, all coming across much of North America to us. We have really good vaccines that have been proven effective for all three of those diseases. If it's appropriate for you, that you're at risk for those things like me, then you're taking the appropriate vaccinations for your age group and for the diseases that come to your area, which are those three. Another topic, we've had this most beautiful medicine for a long time known as acetaminophen, which is a very effective pain control medicine. It's effective across all patient groups, from the youngest to the oldest patients, and those that have a baby in their belly and those that don't. By all medical studies, acetaminophen is very safe. And the only group that doesn't do well with acetaminophen are people who have long-term liver failure problems. Because acetaminophen, every drug has to be broken down by some organ, and typically that's either the kidney or the liver. And it happens that acetaminophen is broken down by the liver. When it's broken down by the liver, if your liver's not very effective because of long-term liver disease, then you know not to take acetaminophen. Otherwise, a very effective, very safe drug given across the world in tens of billions of doses, no doubt by this time. No medical studies have ever associated with any medical issues. And so please, if you need to take that medicine, you take it. On the treatment side, the new set of medicines that have been on the news recently relate to something that's this part of the year, which is our seasonal allergies. So here we are heading into a time when across much of the country, there's enough wind to stir up the pollens, and for all of the grasses and trees that are doing their final seeding this time of the year is miserable for some people. So a couple things. Number one, avoid getting into the allergy issues that cause you a problem. That could be things like raking leaves, mowing grass, using your blower, etc., going out and doing a farm ride, hay ride, and that kind of stuff. If it's going to make you miserable, don't go on it. If you do have to go on it for some reason, try to protect yourself from inhaling it and getting it in your eyes. So you use a little eye protection and a simple mask on your face to try to reduce. When you get home, shed your clothing outside, take a shower, hose yourself off with a hose outside. Do something that gets that allergen off of you as quickly as possible. A number of effective medicines Sometimes you can rinse your nose with nasal spray. You can take antihistamines, and some of the newer ones are less sedating than our old standbys like Benadryl. And for the next level of allergies, I just want to make you aware that a new class of medicines has come out, which is a well-designed way of delivering the most effective drug for allergies, which is epinephrine or adrenaline. And for people with very severe allergic reactions, this now, rather than being delivered with a needle, is delivered in the nose. So you have seen these devices before, used for the administration of naloxone for people having reactions to opiate medicines that they either accidentally got or somehow were administered. And we've used this type of device for administration of naloxone for the last few years. Well, this is now packaged with epinephrine. Epinephrine is a medicine used for serious allergies. So this is for people who have a history of anaphylaxis, which is the most serious of allergies. It's a life threat in some people. And it can come from penicillin and other medicines. It can come from certain types of fish exposures. It can come from peanuts and nut-related things. And that's a really important use of this because many of the nut allergies are in our younger people. And the last thing the parent wants to do is to have to make a decision about sticking an auto injector of epinephrine into their child. This in a brand name known as Neffy, it is epinephrine, and it's in a very fine spray contained within this very small container. The use of this, instructed by your doctor or by the pharmacist, is to simply take the cap off and then to spray it in one of the nostrils. It produces a very fine mist, and that adrenaline or epinephrine goes in as absorbed by the really, really potent blood vessels in your nose and gets carried to the place where it reduces or eliminates the reaction. Imagine this in the nose as an alternative to a big long needle going into the muscle. Some people need that needle, and very late in any kind of anaphylactic reaction, we clearly have to go to the needles. So for my EMS and emergency department people, we have to get that medicine delivered into the central system, and we do that with shots, and we do that with IVs. But early on in anaphylaxis, this is a new tool in the toolkit. The price of this is less than injectors. Many insurance companies really like this kind of packaging because it prevents serious reactions in the patients that they're paying to be insured. And if we take this and get it aboard very easily and quickly, then we avoid a trip to the emergency department and all of the potential medical effects that can come from being exposed to something that you're very allergic to. So those of you with severe allergies, this is a new tool to talk about with your healthcare provider. It is prescription only. Here we are, it's fall. We're going to stay healthy and talk about healthy topics for the next few months as we get into the period of time where we'll talk about infectious diseases and cold stuff. Enjoy the fall. Colors are coming to some parts of the country very soon, and it's a really cool time of the year. Enjoy. Thanks for listening to Doc Talk.